Welcome to our comprehensive guide on periodontal treatment planning. The main goal of any treatment plan is to achieve total care, which means coordinating all procedures to create a well-functioning dentition within a healthy periodontal environment. A treatment plan acts as the blueprint for managing each case, ensuring that every step is performed systematically and in the correct sequence. Planning ahead is crucial for establishing and maintaining periodontal health, as it allows for the anticipation of potential complications and the integration of various therapies. In this video, we'll walk you through each phase of the treatment plan, highlighting the importance of structure and logical progression. A successful periodontal treatment plan is built on a well-defined sequence of therapeutic procedures. Each phase is designed to address specific needs, from emergencies to maintenance. By following a systematic approach, clinicians can ensure that all aspects of oral health are considered and treated appropriately. This logical sequence not only improves outcomes but also helps patients understand the steps involved in their care. Let's begin by exploring the preliminary phase, which focuses on immediate concerns and emergencies. The preliminary or emergency phase is all about addressing urgent dental issues. This includes treating dental or periapical abscesses, periodontal abscesses, and extracting hopeless teeth. If necessary, provisional replacements are provided to maintain function and aesthetics. By resolving emergencies first, the foundation is set for further treatment, ensuring that the patient is comfortable and stable before moving on to more comprehensive therapies. Phase 1 therapy, also known as the idiotropic phase, targets the root causes of periodontal disease. This phase includes plaque control, diet management, removal of calculus, and root planing. Correction of irrational restorative and prosthetic factors is also addressed, along with excavation of caries and restorations. Antimicrobial and occlusal therapies, minor orthodontic movements, and provisional splinting are performed to reduce pocket depth and inflammation. This phase lays the groundwork for healing and prepares the patient for further interventions. Effective plaque control and diet management are essential components of Phase 1 therapy. Patients are educated on proper oral hygiene techniques and advised to make dietary changes that support periodontal health. Removing plaque and controlling diet help reduce inflammation and prevent further disease progression. These steps empower patients to take an active role in their treatment and lay the foundation for long-term oral health. Removing calculus and performing root planing are critical steps in Phase 1 therapy. These procedures eliminate irritants from the tooth surfaces and roots, promoting healing and reducing pocket depth. By thoroughly cleaning the teeth and smoothing the roots, clinicians create an environment that discourages bacterial growth and supports tissue regeneration. This meticulous approach is key to achieving lasting periodontal health. Correction of irrational restorative and prosthetic factors is necessary to prevent further periodontal damage. This involves adjusting or replacing restorations that contribute to plaque accumulation or interfere with oral hygiene. By addressing these issues early, clinicians can minimize complications and enhance the effectiveness of subsequent therapies. Proper restoration supports both function and aesthetics, contributing to overall treatment success. Excavation of caries and placement of restorations, whether temporary or final, are performed during Phase 1 therapy. These steps restore the integrity of the teeth and prevent further decay. By addressing caries early, clinicians protect the supporting structures and ensure that the patient is ready for more advanced procedures. Restoration of carious teeth is a vital part of comprehensive periodontal care. Antimicrobial therapy and occlusal adjustments are important for controlling infection and improving function. Antimicrobials help reduce bacterial load, while occlusal therapy addresses bite issues that may contribute to periodontal disease. Minor orthodontic movements may also be performed to correct alignment and facilitate oral hygiene. These interventions support healing and enhance the overall effectiveness of the treatment plan. Reducing pocket depth and managing gingival inflammation are key objectives in Phase 1 therapy. Provisional splinting may be used to stabilize mobile teeth and improve patient comfort. By addressing these issues, clinicians create a healthier environment for the gums and teeth, setting the stage for surgical interventions if needed. This phase is crucial for preparing the patient for the next steps in their treatment journey. After completing Phase 1 therapy, it's essential to evaluate the patient's response. This involves rechecking for plaque, calculus, and caries. By assessing the effectiveness of initial treatments, clinicians can determine if further interventions are needed or if the patient is ready to proceed to surgical therapy. Continuous evaluation ensures that the treatment plan remains tailored to the patient's needs. Phase 2 therapy involves surgical procedures to further improve periodontal health. These include pocket reduction or elimination, regenerative techniques, and periodontal plastic surgery. Root coverage procedures and widening the attached gingiva are performed to enhance aesthetics and function. Pre-prosthetic surgeries, such as crown lengthening and ridge augmentation, prepare the mouth for restorative work. Osseous surgeries and implant placement are also part of this phase, addressing both resective and regenerative needs. Pocket reduction or elimination procedures are designed to decrease the depth of periodontal pockets, making them easier to clean and maintain. Techniques such as gingivectomy and periodontal flap surgery are employed to remove diseased tissue and promote healing. Regenerative procedures help restore lost bone and support structures, improving both health and aesthetics. These interventions are tailored to the patient's specific needs and are critical for long-term success. Periodontal plastic surgery techniques are used to improve the appearance and function of the gums. Root coverage procedures, such as connective tissue and epithelial grafts, are performed to address recession and enhance aesthetics. Widening the attached gingiva helps protect the teeth and supports oral health. These advanced techniques require careful planning and execution to achieve optimal results. Preprosthetic surgical procedures are performed to prepare the mouth for restorative work. Crown lengthening, with or without osseous recontouring, and ridge augmentation are common techniques used to create a stable foundation for prostheses. These procedures ensure that restorations fit properly and function effectively, enhancing both comfort and aesthetics for the patient. Implant surgery is a specialized phase of periodontal treatment. Guided bone regeneration, placement of implants, and sinus lift procedures are performed to restore missing teeth and support oral function. These advanced techniques require careful assessment and planning to ensure successful outcomes. Implant surgery not only improves aesthetics, but also enhances the patient's quality of life by restoring chewing ability and confidence. After surgical interventions, re-evaluation is essential to assess healing and determine the need for further treatment. Clinicians monitor tissue response, pocket depth, and mobility, ensuring that the patient is progressing as expected. This ongoing assessment allows for timely adjustments and supports the overall success of the treatment plan. Phase 3 therapy focuses on final restorations and prosthetic solutions. Fixed and removable prostheses are placed to restore function and aesthetics. Evaluation of response to restorative procedures and periodontal examination are conducted to ensure that the patient is achieving optimal results. This phase marks the transition from surgical to maintenance care, emphasizing the importance of ongoing evaluation. Evaluating the response to restorative procedures is a critical step in Phase 3 therapy. Clinicians assess the fit, function, and aesthetics of prostheses, ensuring that they meet the patient's needs. Periodontal examination and re-evaluation help identify any issues that may require further intervention. This thorough approach guarantees that the patient receives the best possible care. The maintenance phase is essential for preserving periodontal health over time. Periodic recall visits are scheduled to monitor plaque and calculus, gingival condition, occlusion, tooth mobility, and other pathologic changes. Regular re-evaluation ensures that any issues are detected early and managed promptly. Maintenance therapy supports long-term success and helps patients maintain their oral health. The objectives of the re-evaluation phase are to assess tissue response after therapy, monitor gingival inflammation, pocket depth, and mobility, and evaluate the patient's compliance with oral hygiene. Clinicians review plaque and bleeding indices, oral hygiene scores, and plan for any further periodontal therapy if needed. This phase ensures that the treatment plan remains effective and responsive to the patient's needs, supporting ongoing oral health.